So good morning, everyone. I am joined here today by representatives from our local healthcare community as well as elected officials in our area. I'd like to start by thanking our healthcare professionals and their teams for all of the work that they are doing to keep our community healthy and safe. As of this morning, East Baton Rouge Parish does not have a confirmed case of COVID-19, also known as the coronavirus. However, this is a very fluid situation, as I'm sure you know by now, and things could change from moment to moment. So the public needs to take this pandemic very seriously because Louisiana is experiencing the spread of the virus at a more rapid pace than other states. Some of our citizens have already lost their lives, and I strongly urge the public to practice good hygiene and social distancing by avoiding crowds. I am enforcing Governor Edwards' ban on gatherings of a certain size. Slowing the spread of COVID-19 is essential to protecting lives. Not everyone who is infected will have symptoms or need to be hospitalized, but some will. The aim is to keep the number of cases reported each day as low as possible. And I've said this time and time again, keeping those numbers as low as possible so that hospitals don't become overwhelmed. Individuals without symptoms can carry and spread the disease without realizing it. Social distancing is not a buzzword. I know you've heard it a lot. There are actions that stop or slow down the spread of this highly contagious disease. Social distancing measures include limiting large groups of people from coming together, closing buildings, and postponing events. The CDC recommends staying 6 feet away from other individuals and self-isolating if you are sick. Individuals showing symptoms of COVID-19, that is a cough, a fever, or shortness of breath, should call their medical provider and schedule a screening. To help alleviate some of the pressure on our emergency rooms and healthcare centers, starting today, the Mayor's Office of Homeland Security and Emergency Preparedness is standing up a drive-through community testing center in Baton Rouge. These types of centers have been successful in other parts of the country and in other parts of the world in helping to reduce the risk of exposure to patients, visitors, and medical staff by eliminating the need for someone to get out of the car and interact with others. Any individual with signs or symptoms of the flu or coronavirus must call their medical provider for a referral to the community testing center. Only patients with a provider order faxed to the testing center will be administered a COVID-19 test. I feel that merits repetition. Any individual with signs or symptoms of the flu or coronavirus must call their medical provider for a referral to the community testing center. Only patients with a provider order faxed to the testing center will be administered a COVID-19 test. When they arrive, patients will show their provider order, state-issued ID, insurance card, and remain in their vehicle with healthcare professionals administering the test. If you are bringing a child for testing, the guardian's name must match the name on the provider order. Individuals who do not have a primary doctor should call 211 for support in connecting with a healthcare provider. If you do not have a healthcare provider or a primary doctor, you should call 211 for support. The test will take 3 to 4 business days. with the results sent to the healthcare provider who ordered the tests. Patients, when possible, should isolate themselves in a separate room, and if possible, use a separate bathroom. If symptoms worsen, contact your healthcare provider. This site is intended for people who have symptoms of COVID-19 but do not need emergency care. Again, you can only go there if you've already talked with your medical provider and he or she has ordered the COVID-19 test for you. Just to be clear, if you show up without a referral, you will not be tested. So don't drive up to the center if you haven't called your doctor and received an order for a COVID-19 test. And we're giving you all the information possible so you can connect with a primary provider if you need to get an order. This site will be located in Mid-City at Baton Rouge General's campus and will be staffed by clinicians from Baton Rouge Clinic, Baton Rouge General, Ochsner Baton Rouge, Our Lady of the Lake, and Women's Hospital. The testing center will be open from 1 p.m. to 3 p.m., Monday through Friday, although those hours of operations may change as this is a fluid and evolving situation. While we have been able to secure more supplies and testing kits, our supplies are not unlimited. We are relying on our healthcare providers to ensure we are only testing the people who need the test the most. In addition to staff from our local hospitals and clinics, Baton Rouge Police will be at the testing center to provide security and traffic management. I really want to thank the men and women of City Parish for their support in this effort, including EMS, Baton Rouge Fire Department, DPW, Transportation Information Services, and Buildings and Grounds. So I want to urge everyone that if you are experiencing signs or symptoms of the flu or COVID-19, please start by calling your physician. If you are a Medicaid patient and you do not know who your physician is, look at the back of your Medicaid card and call the number there. If you don't have a Medicaid card and you don't have a physician, then call 211. I will now turn this over to Dr. Katie O'Neill with infectious diseases. She is a specialist from Our Lady of the Lake Hospital. Dr. O'Neill.
Thank you, Mayor. Good morning. The Baton Rouge community of medical providers and the Mayor President's office have worked very hard over the last week to be able to provide you an outpatient testing site that is safe and efficient and will keep the burden of disease outside of our clinics so that our patients who continue to seek care for their chronic medical conditions can safely arrive in clinic, and will keep that disease also out of our ERs who are actively working to continue to triage, care for, and treat patients. We hope that this site will provide a relief to our clinic staff and our medical providers so that they don't have to continue to test and use personal protective equipment themselves. As the mayor stated, we want to make sure that everybody understands that they must seek care through their provider by calling their provider's office and asking for an order, a televisit, or a visit with their provider. They have to have an order to come to the testing site. Call your doctor's office for instructions on how they would like to assess you, and they will give you instructions on the testing site and whether you qualify for an order for coronavirus testing. Those patients who qualify for orders for coronavirus testing will be those patients who fit the criteria set forth by LDH and the CDC for coronavirus. We will not be testing and strongly discourage the testing of asymptomatic patients at this time, as testing supplies are limited. We would like to triage and treat and test those patients who are exhibiting flu-like symptoms and have been ruled out for other causes of those flu-like symptoms. We appreciate the mayor's office and all of the help that the medical community has provided so that we could put up this testing site today to provide a very safe and efficient process for our patients. We look forward to serving the community. Thank you so much.
Thank you, Dr. O'Neill, and all of the medical professionals who have helped make this happen. I will now turn this over to Edgardo Tanero, who is the CEO of Baton Rouge General, whose Mid-City campus will host the drive-through community testing center. Edgardo?
Thank you, Mayor. I want to reassure everyone that even though this testing site is located at our Mid-City campus, this has been an effort amongst all of the healthcare community, all of the hospitals and the mayor's office. And so I want to reassure everyone that in this time of crisis, you need to know that we're working very, very hard, coordinating incredibly well amongst all the providers. So I want to thank the mayor, Ochsner Hospital, the Baton Rouge Clinic, all the staff of the Baton Rouge General, Women's Hospital, and Our Lady of the Lake for coming together in a time of crisis to assure you the best possible scenario in terms of outpatient testing. Thank you.
Thank you so much, Mr. Tanero. Again, as of this morning, East Baton Rouge Parish does not have a confirmed case of COVID-19, but that could change at any moment. We all know that. We're prepared, but the public needs to take this pandemic very seriously. The disease is spreading faster in Louisiana compared to other states. Some of our citizens have already lost their lives, as I shared earlier. And I'm going to repeat what you've heard many times before. We must practice good hygiene, social distancing, and I am certainly enforcing and in alignment with Governor Edwards' ban on gatherings of a certain size. Slowing the spread of COVID-19 is essential to protecting lives. If it spreads too quickly, our hospitals can become overwhelmed and many people could die. That is why it's important to limit large groups of people and postpone events. That's the responsible thing to do. The CDC recommends staying 6 feet away from other individuals and self-isolating if you are sick. Of course, as I said before, individuals showing symptoms of COVID-19, coughing, having a fever, shortness of breath, should call their medical provider immediately and schedule a screening. Please take this very seriously, and please help all of us as we work together to protect the lives of our friends and our neighbors. Once again, thank you to our medical professionals for helping us make this happen. Thank you to all the elected officials who have joined us today, and now I'll open it up for a few questions. It was brought to my attention that there were several large gatherings that took place across the city this weekend, which were certainly contradictory to what I asked people to do. That's unfortunate, because when you do that, you put the whole community at risk. When you are having large gatherings of 250 or more, and that number is consistently changing, it means you make our city, your neighbors, your friends, your family more vulnerable. And so when these large gatherings were brought to our attention, we immediately asked BRPD to look into it, and as it is my understanding, they proceeded to disperse the group. But I would like to encourage everyone who's listening to this. I believe the majority of the people in this city and in this parish want to be safe. I believe the majority of the people in the city and parish want to adhere to the guidelines so we can minimize the impact. So my communication to everyone is to hold your fellow citizens accountable. And if you see something like that going on, I would encourage you, or you know something like that emerging, I would encourage you to spend time sharing. Do not put us at risk. So this is an evolving situation, as you've heard us say before. Right now we're having a press conference at 11:30. I'm going to be on another call for mayors at 12:15. We are constantly doing best practices to make sure we maintain or minimize, I should say, the impact of this COVID-19. So I am encouraging people to stay tuned to the information that we put out, to not adhere or promulgate rumors and viral misinformation that often goes out, but look to city parish government, to the governor's office, and to the CDC for accurate information. And I will tell you that the federal level, the state level, and the local level, in most instances, we are in alignment. And so as we continue to deal with this issue of the coronavirus, we will take the necessary steps to make sure that our citizens are kept safe. Let me add this too. There's so many moving parts to this. We're talking about the healthcare aspect now. You mentioned government buildings, and we are taking steps for city parish employees to work with them and mitigate their being exposed to this. I have been in communication with the business community, and we will have another follow-up with the business community this week. And so it is my admonition and encouragement that in the midst of this, please support our local businesses. If you can go and pick up something at a restaurant, like I've done twice this weekend for my staff and for my family, I encourage you to do that. It does not mean you have to dine in, but at the same time, you're supporting our local businesses. So we're going to do our best as city parish government to make sure we operate and hold everything together for everyone from every perspective, so we can manage this virus, but more importantly, sustain our community to a level of normalcy to the extent that we can. And so if you don't have insurance, you won't be left out. That's why we're encouraging people also to call 211. We don't want anyone left out in this process if they have symptoms, right? And so that would be irresponsible for us as a compassionate healthcare community as well. So if someone doesn't have insurance, they should contact 211. And also, one of our partners in this process are the federally qualified health centers. And so they will be there as well to help respond to individuals. I don't think we're going to fall behind. That's my initial reaction, because I believe we're already taking proactive steps that positions us, and this opening this testing center will be one of those, indeed, proactive steps. Dr. O'Neill, do you have any other information around that?
The medical community in this initiative allows us to increase our testing capacity while keeping our healthcare workers safe. Our medical community has been using LDH and CDC guidelines for testing for some time now. Our concern was that we were pushing testing to the outpatient area, and they weren't prepared to do that testing in their office. But our hospitals and the community have been attempting to test people for a while and following those guidelines for testing. This just increases our capacity and is what you want to be on the cusp of helping out the CDC and our community with diagnosis.
Let me just say this. I wasn't on the scene because I was busy trying to be proactive and work on this bigger issue right here that we're dealing with. I will tell you that Chief Murphy Paul, when he became aware of it, he used his law enforcement acumen to address the situation, and the crowd was dispersed. If you want any additional information, I would say a phone call to Chief Paul would certainly be adequate. But the bigger picture here, and this is what I've tried to get everybody to understand, don't have these large gatherings. I don't care who you are. You're making our population vulnerable. And so that is the message. People should not be having it. If you see someone that you think is getting ready to emerge with a big party or something, let us know. Let law enforcement know. And I believe as we continue to move forward in addressing this COVID-19 issue, that you will see a stronger effort of enforcement. And once again, this is a collaborative effort, federal, state, and local. Okay? We're not playing favorites with anybody. Let me just say that. I don't want people having large gatherings. I don't want people exposing the city and parish and making them vulnerable. So don't do it. So we have faxes coming in already, and that's how people are communicating. So we have faxes coming in from providers. So I don't know if those tests will take place today. They will take place today. That's what we're being told.
We all know that personal protective equipment is the only way to keep our healthcare workers safe, and that this disease is not going away next week. And so while we have personal protective equipment for our healthcare community in Baton Rouge right now, we are doing our best to preserve that personal protective equipment as best we can. One of the ways that we will do that is to set up this community testing center today. And that allows our clinics not to have to use so many masks and gowns and gloves to test these people in their own clinics. So by pulling that to one center place, we're protecting our healthcare workers, we're preserving our PPE for those who need it in the hospitals, and overall being safer for our patients.
And if I may add that all the materials management directors of the major the hospitals in town have just started to meet on a regular basis to keep inventory of all the supplies that we need to make sure that we can help each other on quick notice. Thank you.
I would say I don't want people to panic, right? I believe very firmly working with one another, collaborating with one another, being proactive with our healthcare providers, that we will get through this pandemic as a city and as a parish. If you're stocking up, remember your neighbor as you stock up, and you may want to share some of that with your neighbors who can't get supplies. But it's my understanding also, that our retail providers are aware of what's taking place, and they're trying to do their best to maintain their shelves being stocked. So I believe what you see with people rushing out to get supplies represents perhaps fear, that people are fearful. And we don't want people to react fearfully, but to react responsibly and to consider others as they do their purchasing. I believe we'll be fine at the end of the day, but this is a process. We can't take it lightly. We have to take it seriously. Thank you so much. And thank you all for being here today. I really appreciate it. Thank you to our healthcare providers and all who are here.